Welcome to the Mindfulness Channel, a channel focused on brain science and mindfulness-based information and skills to help transform your mind-body so you can be the best you. If this is your first time joining us, don't forget to hit the like and subscribe button, and welcome back to those familiar with this channel. The current paradigm for treating chronic pain often focuses on physical origin of the pain. And sometimes, if the patient is lucky, they get referred to a pain management clinic as the last resort. Now, most of my patients take about 52 months, that's a little bit more than 4 years, before they get proper help from modern pain neuroscience using mind-body practices and off the medical merry-go-round of interventions that don't seem to work or promote pain recovery. Now, in 1991, Dr. John Sarno published a book called Healing Back Pain. His messages in that book and several other books he wrote highlights the focus of healing chronic pain by addressing unexpressed emotions and acknowledging there is no more damage, that your body is healed, but the tension in your body is your mind's way of distracting you from, the real issues, the emotional issues or chronic life pressures that are not being addressed. He coined the term tension myositis syndrome, TMS. Since then, there have been many other names to depict Sarno's conceptualization of why pain persists, such as PPD, MBS, FND, and many, many more. Science now affirms that our thoughts, emotions, especially unexpressed emotions or unprocessed traumas, and our choices and behaviors influence the development and the maintenance of physical conditions such as chronic pain. Science now affirms that our thoughts, emotions, especially unexpressed emotions or unprocessed traumas, and our behaviors influences the development and maintenance of physical conditions such as chronic pain. Some of you may have heard of something called the psychosocial model. The psychosocial model was developed by Dr. George L. Engel. Now, this model originally was created to help physicians and treating providers not just understand their patient's chronic medical condition, but to see the patient as a whole person, not just for their symptoms, but to evaluate the patient's psychological and social environmental well-being when coming up with the best treatment plan. Let's take a quick look at Engel's model to highlight the mind-body-pain connection. Biological factors are like nervous system, immune system, digestive system, endocrine system, and so on. Psychological factors could be beliefs, expectations, coping skills, one's emotional health, traumas. And social factors could include family support, social connection, cultural beliefs, etc. See, if you're like my typical patient who has been doing everything and anything to get rid of the pain through traditional medical interventions, you may find yourself suffering and eventually maybe even giving up and living a life with less vitality. The way to think about the mind-body pain connection is that when you have a chronic condition such as chronic pain or trauma, depression, or even anxiety, it is the psychosocial factors that superimpose, amplify, and tend to maintain danger and me messages to your brain and body, which then becomes learned in your circuitry in service of your survival. Pain is a protection from something inside of you, outside of you, or what is in between you. If your doctors have cleared you of any serious medical infections or life-threatening diseases, then it's time now for you to acquire the skills to retune your mind-body pain connection and get the right support to move forward towards pain recovery. Just know you're not alone, and don't do this alone. Until next time, be kind to yourself and know that you're more than enough. I'm Dr. Les, and I'll catch you at the next moment. So if you're interested in pain recovery, check us out on Menda.health.